In the healthcare setting, it is common knowledge that consent is important, and a patient can make their own decisions as long as they're considered capable or they have the capacity to. According to the Healthcare Consent Act, capacity is determined by two things: your ability to understand the information that's relevant to making the decision, and your ability to appreciate the reasonably foreseeable consequences of said decision. Now, I knew that the capacity criteria applied to patients, but I thought that it might be a little bit different or complicated when it came to patients with mental health disorders or cognitive impairments. Considering their history of treatment in the healthcare system, I thought there might be some discrimination against them in terms of determining capacity, but that's not exactly the case. While they may experience discrimination and unfair treatment, technically there are laws in place to protect their right to autonomy and self-determination. The criteria that the Healthcare Consent Act put forward in terms of determining capacity is equal for all patients. And it's also important to note that a physician must assume that a patient is capable unless there are grounds to believe otherwise. And there's also two important points to consider for capacity when it comes to patients with mental health disorders and cognitive impairments. The first is that capacity is not static. It can change from one point to another, especially considering people with mental health disorders and cognitive impairments, where they may be in a lucid state and capable at one point, but then their disorder might flare up and they may become incapable at another point. And so a case that demonstrates this is the Nito versus Kluge case. In this case, Nito was diagnosed with bipolar affective disorder, and when she came into the hospital one day for an appointment, she refused the medication that the physicians had prescribed her. The physicians deemed her incapable because they thought that her refusal of this medication was based on her delusional thoughts, and even the Consent and Capacity Board deemed her incapable because they thought that she couldn't appreciate the reasonably foreseeable consequences of her decision. But Nito did appeal to the court, and the court did conclude that she was in fact capable because her decision to refuse the medication was not based on the delusional thoughts that she had. And after being given antipsychotic medication and being in a more calmer state, she was able to understand the information relevant to making the decision, and she was able to appreciate the reasonably foreseeable consequences of her decision. So she was deemed capable, and her decision to refuse the medication was respected. Another point about capacity is that as long as a person is deemed capable, they can make any kind of decision they want, whether it is in their best interest or not. A case that demonstrates this is the Re-C adult refusal to treatment case, where a 68-year-old male with schizophrenia came into the hospital with gangrene in his foot. Now, the physicians suggested amputation of his leg, but the patient refused. The physicians thought that he was incapable of making this decision because the schizophrenia affected his capacity. While the schizophrenia did influence his capacity, they found that he was still able to understand all the information that was relevant to making the decision and that he could appreciate the reasonably foreseeable consequences of his decision. So he was deemed capable, and his refusal for the amputation was respected. And so there are procedures in place to ensure that people with mental health disorders and cognitive impairments can make certain decisions as long as they are deemed capable. And I also wanted to point out that while the two cases that I talked about here show that the patients, were deemed capable and that they could make their own decisions, that may not be the case for everyone because capacity is measured on a case-by-case basis, and also not everyone with the same diagnosis may have the same level of capacity or capability. And so many people with mental health disorders and cognitive impairments may also be considered incapable in similar situations and not be able to make their own decisions. But at the end of the day, there are laws in place that do protect the autonomy and right to self-determination of people with mental health disorders and cognitive impairment.